This is section 1.6. We're going to start talking about how we design experiments. So first we'll talk about the characteristics of an experiment, and then we'll talk a little bit about how we design one. So an experiment is a controlled study conducted to determine the effect that varying one or more explanatory variables or factors has on a response variable. A treatment is any combination of the values of the factors. So if a factor was a type of medication and another factor was the type of diet, a treatment might be taking the medication and having a low-fat diet. Another treatment might be taking the medication and having a high-fat diet. Or it could be not taking the medication and having a high-fat diet. So it's any combination of the factors and their values. An experimental unit is the person, object, or other well-defined item upon which we're applying a treatment. So, of course, when the experimental unit is a person, we refer to them as a subject. So, a lot of times when we do an experiment, we also have a control group. And a control group serves as a baseline treatment that can be used to compare to other treatments. And you can define the control group by either accepted practice, meaning this is common and this is what everybody agrees to use as a control group, or by placebo. And I'm sure a lot of you have heard of the placebo effect, but in case you haven't, a placebo is an innocuous medication. It's really not even a medication, something like a sugar tablet that looks, tastes, and smells like the experimental medication, but actually doesn't have any of the medicine in it. So it makes the person think they're taking the drug, but they're not. The other thing we need to talk about in terms of experiments is what we call blinding. So blinding is the term we use to describe the non-disclosure of the treatment that an experimental unit is receiving. So in a single blind study, or experiment, the experimental unit or subject does not know which treatment they're receiving, but the researcher does. In a double-blind experiment, neither the researcher nor the experimental unit know which treatment this experimental unit is receiving. So most medical trials, I think, are probably double-blind. And that's because they don't want the physician to do anything differently in treating the patients. Because if you know a patient's getting a placebo, say for a high cholesterol medication, you might encourage the one who is the subject who's getting the medication. You might not encourage, a low cholesterol diet. But if you are the physician and you know for a fact that they're getting the placebo, you might change how you treat them and tell them they should have a low cholesterol diet. So let's talk about an example and how we determine what types of things are going on here. So in a study, Lipitor, which is a cholesterol medication, was assessed in 2,838 subjects aged 40 to 75 with type 2 diabetes, without prior history of cardiovascular disease. In the placebo-controlled double-blind experiment, subjects were randomly allocated to either Lipitor, 10 milligrams daily, and that 1,428 in parentheses is how many of the subjects, or the placebo, and that 1,410 is how many of the subjects were in the placebo group. And then they were followed for 4 years. The response variable was the occurrence of any major cardiovascular event. So how was the control group determined? Well, this is where we have to have close and good reading skills. It said that the study is placebo controlled. So we know the control group was determined by placebo. Okay, what does it mean for the experiment to be double blind? Okay, recall that double blind means neither the subjects nor the researchers know whether or not each subject is receiving Lipitor or placebo. And that way, neither the subjects nor the researchers behave differently. Okay, what's the population for which this study applies? Well, let's go see what type of people were in the study. So it says people aged 40 to 75 with type 2 diabetes without a prior history of cardiovascular disease. So that means the population is going to be all 40 to 75-year-olds with type 2 diabetes and no history of cardiovascular disease. Okay, what is our sample? Well, our sample is the total number of people that were in the study. So that's 2,838. 2,838 people aged 40 to 75 with type 2 diabetes, and I'm going to abbreviate this by writing no heart disease instead of cardiovascular. So what are the treatments? Well, the treatments are the things that each group gets givens. So one group was given 10 milligrams of Lipitor and the other group was given a placebo. And that happened daily for both groups. So those are the treatments. What's the response variable? In other words, what were they seeing when they followed these patients for 4 years? They were seeing whether or not the subject had a cardiovascular event. Okay, now it's time to dig deep back to closer to the beginning of this chapter. Is that response variable qualitative or quantitative? Remember, qualitative is characteristics and quantitative is numerical. So whether or not we had a cardiovascular event is not a number. So it is a qualitative variable. Okay, what's the explanatory variable? The explanatory variable is tied up with our treatments. So in this case, the explanatory variable is either the 10 milligrams of Lipitor daily or placebo. All right, we'll end right here, and in the next video, we'll start talking about how we design an experiment.